This is the model of liver. Here in the green color, this is the right lobe. In the blue color, this is the left lobe. And this is the falciform ligament. Here it diverges to form the right side superior coronary ligament and left superior coronary ligament. If we look the posterior inferior surface of the liver or visual surface, what we are seeing, this is the stomach, and the stomach is attached to the liver via the lesser omentum, the peritoneal fold. Okay, this is the second layer of the lesser omentum in white color, and this red color, this here, just wait for a minute. Here in red color, this one, this is the anterior layer of the lesser omentum. Anterior layer of the lesser omentum, it starts from the, here is the lesser curvature of the stomach. Here you can see this is the lesser curvature of the stomach. Here, this is the esophagus, and here is the lesser curvature. Then this is the first part of the duodenum, this is second part of the duodenum, third part of the duodenum. So from here to here is the lesser curvature. Okay, so first layer, or you can say anterior layer of the lesser omentum, it starts from the proximal part of the lesser curvature and going to the left limb of fossa for ligamentum venosum. This H-shaped area we can see here. This is the abdominal aorta. This is abdominal aorta, and from which the celiac trunk is emerging out from its anterior aspect and giving rise to the splenic artery, and then the left gastric artery, and this one is the common hepatic artery, which divides into the gastroduodenal artery and hepatic artery proper. This one is the hepatic artery proper, from which the right gastric artery, it emerges out, and right gastric artery anastomosis with the left gastric artery. And this is the whole of this. From here is the hepatic artery proper, which is giving rise to the right hepatic artery and the left hepatic artery, and right from the right hepatic artery, it is cystic artery is coming out. Okay, so this is the celiac trunk, but where it is in relation with the caudate lobe, which is shown in the yellow color. This one is the caudate lobe. Okay, and this thing is the porta hepatis. Okay, and the H-shaped area, you can see, if I will H-shaped area, here is the fossa for the ligamentum venosum. This is the left limb, this is the right limb, here is the vena cava, and here is the gallbladder. This one is the gallbladder. This is the beneath the celiac trunk. This is the, in yellow color, this is the caudate lobe, and this is, here is the quadrate lobe, and here is the in this line the fossa for the ligamentum venosum. In this line there is fossa for the ligamentum teres, but below here. Okay, now coming to the anterior layer of the lesser omentum, it starts from the proximal part of the lesser curvature and then going to the left limb of the fossa for the ligamentum venosum, and from the distal part of the lesser curvature, it starts and going to the, this is the anterior margin of the porta hepatis. What is the anatomical position? If we hold liver like this, that will be the anterior margin, and this will be the posterior margin of the porta hepatis. So the anterior layer of the lesser omentum, here by the side of the stomach, it is attached to the distal part of the lesser curvature, and then here up to the anterior margin of the porta hepatis. And the second layer, which is shown in this white color, it is going up to the right limb. This is the right limb of the ligamentum venosum in red color, this one. right limb of the ligamentum venosum, and here it is going up to the posterior margin. This is the posterior margin. Anterior margin is this one here. Anterior margin is this one and posterior margin is this one. Okay, so the posterior layer, which is shown by this white color, posterior layer of the lesser omentum, at the proximally it is going up to the right limb of the ligamentum venosum, and in its distal part it is attaching the distal part of the lesser curvature and the duodenum, first part of the 2.5 centimeter of the duodenum, going up to the posterior margin of the porta hepatis. Okay, and this portion is also known as the 2.5 centimeter. This one is the hepatoduodenal ligament, from the liver to the first part of the duodenum, hepatoduodenal ligament, and this one is the hepatogastric ligament, which comes in twofold, anterior and the posterior, and also both of them comprises to form the lesser omentum. Now what is the content of the lesser omentum? It is the, here we can see, this is the celiac trunk and this is the left gastric artery, and this is the right gastric artery from the right side, right gastric artery, which is the branch of the hepatic artery proper. Hepatic artery proper is the branch of the common hepatic artery, which also gives rise to gastroduodenal artery, which is going to below and supplying the duodenum. Okay, and what others? Along with the artery there is also vein. So we can say the right and left gastric vein and artery, and the part of the lesser omentum is this gastric nerve, the anterior and the posterior gastric nerve, as well as this one is the lymph node, gastric lymph node. And in the right free margin, this one is the right free margin of the lesser omentum. This is also known as the foramen of Monro, this area in which the base is formed by the inferior vena cava, and this base and the roof is formed by the you can say anteriorly. Okay, the foramen of Monro, its anatomical position is like this. Then anteriorly it is inferior vena cava, posteriorly it is the right free margin of the posterior layer of the lesser omentum, in which the bladder structure is passing through, that is the hepatic artery, portal vein and the bile duct. And above it is restricted by the caudate lobe, this yellow one is the caudate lobe above, and below is the superior surface of the first part of the duodenum here. Okay, this area is the foramen of Monro. Okay.